Welcome to Mental Health First Aid. We are so pleased to have you here today. We realize that most people that come to this course, they say the same thing. What can I do to help? I'm not a licensed therapist. So here's why we need your help. First, mental health problems are very common, especially depression, anxiety, and substance use disorders. In the United States, almost half of adults will experience a mental illness during their lifetime. So, throughout the course of a person's life, it's highly likely they will develop a mental health problem or be in contact with someone who does. And so many people don't know how to recognize mental health problems, how to respond to them, and some of the most practical ways that we can help someone. And there's so many myths and misunderstandings related to mental health problems, many of which we hope to dispel in this course today. So when you think of how you can help, think about this. Professional help is not always available when someone is experiencing a mental health crisis. And it's everyday people like you that can offer immediate first aid, just as you would with CPR, for instance. This is where you bridge the gap. And today we will show you some very good examples of how you can do just that.
In this scenario, a woman has walked in on her coworker during an acute psychosis episode. A person experiencing psychosis may have difficulty distinguishing between what is real and what is not. Psychosis may occur as a part of another mental disorder such as schizophrenia or bipolar disorder. It may also be induced by certain drugs. Severe symptoms include delusions, hallucinations, disorganized thought, and odd behaviors. This person's behavior may be disruptive or disturbing to others, and prompting them to seek assistance is very important. In this crisis situation, always remain calm and evaluate the situation for risks to yourself and to others. Make sure to talk in a clear and concise manner and use short, simple sentences. Speak quietly and in a non-threatening tone of voice at a moderate pace. Your primary objective here is to de-escalate the situation. Be sure to comply with reasonable requests. You want the person to feel like they are in control. In some cases, you may want to assess for risk of suicide. Check with the person to see if they know a trusted friend or family member that you can call for assistance. In this scenario, the woman will be leaving to call someone for assistance. Make sure to wait with the person or at least nearby if they are not an immediate risk to themselves or others.
So let's go over what we know about acute psychosis. The main objective is to de-escalate the situation. Remain calm. Evaluate the risk to yourself, others, and that person. Assess the person for risk of suicide. Assess if they are safe to be left alone. If not, ensure someone is with them. Try to find somebody that the person trusts to assist. Communicate in a clear, concise manner. And use short and simple sentences. Speak in a non-threatening manner. Sit down if necessary to show them that you're not a threat. Comply with requests unless unreasonable or unsafe to make them feel in control. Do not further agitate the person. Maintain your own safety above all else. Call for assistance when necessary. Now, are you ready for a pop quiz? Name one mental disorder mentioned in the video that psychosis can occur as part of. Schizophrenia or bipolar disorder. What is the main objective when administering mental health first aid to someone with acute psychosis? To de-escalate the situation. True or false? Talking in a rapid, loud tone of voice will be best to communicate with somebody with acute psychosis. The answer is false. Here's another true or false question. Some drugs can induce acute psychosis, and you should inform medical staff if you know someone who has taken any drugs, recreational or over-the-counter included. The answer is true. How did you do? Great job. In this video, a woman at a baseball field walks by and sees somebody having a panic attack. There are several signs of a panic attack. Some of them are pounding heart, rapid heart rate, sweating, trembling and shaking, shortness of breath, chest pains and discomfort, feeling detached, chills, and hot flashes. If somebody is experiencing these symptoms and you suspect a panic attack, ask if the person knows what's happening. If you're helping somebody you do not know, introduce yourself. Symptoms of a panic attack can resemble a heart attack or other medical problems. It is not possible to be sure. Only a medical professional can tell you if it is something more serious. If the person has not had a prior panic attack and he or she does not know what's going on, call 911. If a person is actually having a panic attack, reassure them they are experiencing a panic attack. It is important to keep calm. Speak to the person in a reassuring and firm manner and be patient. Speak clearly and slowly. If the person's breathing is rapid, which is common to experience in a panic attack, do not force them to slow their breathing. Instead, remain calm and model a normal breathing rate. It is a myth to recommend they breathe into a paper bag. That can cause them to inhale their own carbon dioxide, which can cause them to become unconscious. After the panic attack has subsided, ask if they know where they can get information about panic attacks. If they don't know, offer suggestions. Tell the person if the panic attack reoccurs and is causing them distress, he or she should speak to a health professional. You should become knowledgeable about the professional help that they can get in the community. Reassure the person that there are effective treatments for panic attacks and panic disorder. So let's review what we know about panic attacks. Signs of panic attacks are pounding heart, trembling and shaking, dizziness, rapid heart rate, shortness of breath, fear of dying, sweating, chest pains and discomfort, chills and hot flashes. Symptoms of panic attacks can also resemble a heart attack. Ask the person if they know what is happening. This will help you find out if they've had a panic attack before. Remain calm, and if rapidly breathing, do not have them breathe into a paper bag. Instead, remain calm and model normal breathing rate. Once the panic attack has subsided, ask the person if they know where they can get information about panic attacks. If panic attacks become reoccurring or cause distress, suggest they speak to a mental health professional. Reassure the person that there are effective treatments available. Let's take a pop quiz. Can you name 3 signs of a panic attack? Here are some of the answers. See if you got any correct. If a person is breathing rapidly, do you give them a paper bag to breathe in? The answer is false. True or false? You should be knowledgeable of where to get help for a panic disorder in the community. The answer is true. What should you do if a person has never had a panic attack and you're not sure if the person is having a panic attack? The answer is call 911. Great job!
Different substances affect the brain in different ways. Alcohol makes people less alert and impairs concentration and coordination. Some people use alcohol to reduce anxiety. In the short term, it can reduce symptoms. Alcohol causes people to relax and lower their inhibitions. Some short-term problems caused by alcohol are physical injuries, aggressive behaviors, and even self-injury. Some long-term problems could be different alcohol use disorders and depression and anxiety. There are many different ways someone can help. Someone can help aid for a medical emergency from alcohol abuse. If you see somebody that is intoxicated, you stay calm. You communicate appropriately. You talk in a respectful manner and use simple, clear language. Do not laugh at, make fun of, or provoke the person. You monitor them for danger. While intoxicated, the person may engage in a wide range of risky activities, such as having unprotected sex, vandalizing property, or driving. You should assess the situation for potential danger and ensure that everyone is safe. So, ensure the person's safety. Do not leave the person alone. Be aware the person may be more intoxicated than they realize. Keep them away from machines and dangerous objects. If the person attempts to drive, try to discourage them by telling them about the risk to self and others. Do not be afraid to seek medical help for the person, even if there may be legal implications. It may be beneficial for a friend or family member to accompany the person to the hospital, as they may be able to provide relevant information. Call an ambulance if the person cannot be awakened or is unconscious, has irregular, shallow, or slow breathing, has irregular, weak, or slow pulse rate, has cold, clammy, pale, or bluish skin, is continually vomiting, shows signs of possible head injury, has seizures, convulsions, blackouts, and may have consumed a spiked drink. If the person is unconscious, you must keep their airway open. If left lying on their back, they could suffocate on their vomit, or their tongue could block their airway. Putting the person in the recovery position will help to keep the airway away. Be aware that alcohol consumption can mask pain from injuries. If the person is vomiting and unconscious, keep the person sitting. Alternatively, put them in the recovery position. If necessary, clear the airway after they have vomited. If the person stops breathing, he or she will need expired air resuscitation. If the person has no pulse, he or she will need CPR.
Let's review what we know about alcohol abuse. Alcohol makes people less alert and impairs concentration and coordination. Short-term problems caused by alcohol intoxication are physical injuries, aggressive behavior, and self-injury. Long-term problems caused by alcohol intoxication are alcohol use disorders and depression. If you see somebody intoxicated, stay calm, communicate appropriately, monitor them for danger, ensure the safety of the person. Here's when you know when to call an ambulance. If the person cannot be awakened or is unconscious, has irregular, shallow, or slow pulse, has cold, clammy, pale, or bluish skin, is continuously vomiting, shows signs of a head injury, has seizures, convulsions, or blackouts, or may have consumed a spiked drink. If a person is unconscious, you must keep their airway open. If left lying on their back, they could suffocate on their own vomit, or they would have their tongue could block their airway. Turn the person on their side and to open up their airway and keep anything from going down their throat. It's time for your last pop quiz. Name one short-term problem caused by the consumption of alcohol. The answer is physical injury, aggressive behavior, or self-injury. What's one thing to do when you witness someone who is intoxicated? The answer is stay calm, communicate appropriately, monitor them for danger, and ensure their safety. If a person is unconscious and can't be woken up, what should you do? Put them in the recovery position if needed and call an ambulance. How did you do? Great job.
So as you can see, you can be at Jack's Beach, you could be downtown, you could be at a festival, on an airplane. What you saw today and you learned in this course could be seen and used in everyday life. And hopefully you leave here today feeling more confident in your abilities to bridge the gap between the professionals and someone in a mental health crisis. So if there are no further questions, this concludes our course. Ensure that you left us with the correct email address and you will receive your certificate in the mail within the next 3 to 5 business days. Also, you'll be leaving here today with a workbook filled with other interventions, websites, and local and national resources. We ask that you continue to review the workbook and you look at some of the fascinating websites that are pertaining to mental health. Good luck out there.